Hello, my name is Jeremy Carroll. I'm a registered nurse, and this is a musculoskeletal and neurological assessment video for Ohio Christian University for the health and assessment and genetics class in our 3400. This is my patient, Tiffany Carroll, with consent, and I would like to inform you ahead of time that I have washed my hands. The first thing we're going to do is we're going to start with the neurological assessment. I'm going to go backwards just so that we can use our time wisely for the patient's convenience. And we would start by inspecting. Tell me your name.
Tiffany.
What's your date of birth?
May 17th, 1979.
Where are you at right now?
My home.
Okay, good. Good. We're looking for clear, coherent speech with an appropriate rate. Also orientation to person, place, and time, like we were just talking about, as well as situation. The first cranial nerve that we would assess is the cranial nerve number 1, which is the olfactory nerve, which is for the sense of smell. Typically, this is not assessed unless a patient has a complaint about that. How's your sense of smell and taste?
Good.
Okay, good to go. Okay. The next is cranial nerve number 2. It's the optic nerve. One of the ways to test that is with confrontation. What I'm going to have you do is I'm going to have you stare at my pen and keep watching it here. Good. Good. The eyes accommodate with that. The next portion of that would be the fundoscopic examination with the ophthalmoscope. Again, making sure that you do same side. So left eye, we're going to do left hand and my left eye. The diopter here on the side helps control for clarity of image. So we're going to start off. I would use my non-controlling hand here to the forehead above the eyebrow. Turn my light source on here, and we are going to use the pinky to kind of control the angle until we get approximately 1 to 2 inches from the face. Changing the diopter angle here to view inside the eye. Good job. And we're looking for, of course, to check the vessels, the retina, the optic disc, and the macula of the eye. Next, we're going to check cranial nerves 3, 4, and 5, which are the oculomotor, trochlear, and the abducens. So we're going to start with a peripheral vision test. So I want you to, good, look at me. It's hard to do with the back here. And stare right in the center. Tell me when you see my moving fingers. Good. Give me a word.
Yes.
Good. How about now?
Okay.
Good. The next thing that we would do is to test the 6 cardinal views. So I'm going to stare in the middle and cover your right eye first. Follow my finger. Out. Up. Down. Across. Good. Cover your left eye, please. Start by looking at my finger. Follow my finger. Up. Down. Out. Across. Good job. And then we're also going to check for the pupil's reaction to light. So we'll get another light source here. And I'm going to have you take a quick peek right here at my forehead. Look at my forehead, please. There you go. Good. And good. Try not to blink. Good. Now, quick. Good. Try not to blink. I know it's really bright in your eye. Try to get it right in there. Good. Okay. I was checking convergence and accommodation, and you'd want to check for nystagmus also to make sure that there was none of that present. The 5th cranial nerve is the trigeminal nerve. I'm going to have you clench your teeth down like you're really biting down hard. Let me feel your jaw. Good job. And the other way to test that is, frequently people use a Q-tip. I don't have one of those with me, so we're just going to use my fingers, but I want you to close your eyes for me and tell me where you feel me touching.
Right. Cheek. Cheek. Jaw. Forehead.
Good. Did it feel about the same? Good deal. Cranial nerve number 7 is the facial nerve. First, I want you to raise both eyebrows. Good. And then I want you to keep your mouth closed and puff your cheeks out. Good job. We're looking for symmetry on both sides of the face. Make sure that there's no lag or droop of any portion there. The next one is cranial nerve number 8, the vestibulocochlear. And I would step behind the patient. I'm going to whisper something, and I want you to tell me what you say out loud.
29. Good. 47.
Good. Good. Excellent job. Next, we'll be testing cranial nerve numbers 9 and 10, which is the glossopharyngeal and the vagus nerves. Again, I need my light source, and I'm going to have you open up. Stick your tongue out first. Back in. Now say ah.
Ah.
Tongue out, ah.
Ah.
Longer.
Ah.
Good. What you're looking for is for the uvula to rise with the saying of the ah, and also that it stays midline. The last cranial nerve is number 11, the spinal accessory. First, I want to just see that you rotate your head to the right, rotate to the left, chin to the chest, head back. Good. Now my hands are kind of cold, so excuse me. I want you to push against my cheek. Push your cheek against my hand. Good. Push your cheek against my hand. Good. Push your forehead against my hand. Good. Pull against my hand. Good job. And then also we're going to have you real quick shoulder shrug. Good job. Okay. The final portion of this, I'm going to have you stand up for me as we're going to check cerebellar function with the Romberg test. And so I want your feet together, and I want you to close your eyes, and I want you to put your hands out in front of you, palms up for me, right there. So go ahead and turn them over. This way, there you go. Hold still, no open eyes. Typically, we would wait 20 seconds to make sure that there was no drifting. You want to make sure you're close by so the patient falls down. That's good. You can open your eyes for a second. Now, I want your arms out straight to the side. Close the eyes again. Left index finger touch the nose. Close your eyes. Right index finger touch the nose. Good job. Okay, and that's completion portion. You can open your eyes. The completion for our neurological portion. Now we'll move on to musculoskeletal. The first thing I'm going to have you do, Tiffany, is starting a little bit further away from me. I want you to walk heel to toe like you're walking on a tight wire. Good job. If you turn around, walk on your tiptoes back to the other side again. And turn back towards me. Walk on your heels. Good job. Go ahead back in the center here. You can face the screen. I want you to squat down with your back straight and then squat back up. Good job. And with each of these inspections of musculoskeletal, we want to make sure that we're checking joints as well as the muscles themselves. So the next part that we're going to be looking for as far as musculoskeletal, we would be looking at scan for abnormalities, temperature, symmetry of trunk, shoulders, and extremities. So the next portion here, while we're still standing, I'm going to have you turn to the side and I'll have you bend at the waist towards your toes. So go ahead and turn sideways. There you go. Bend down, touch your toes. Good. I'm looking at your back, looking for symmetry, making sure there's no one side higher than the other or any curvatures of the spine. You can go ahead and stand back up. And turning back to the front, I want you to arch to the back. Good. Lateral side bend, left, lateral side bend, right. Good. Twist right shoulder and left shoulder to the front without moving your feet. Good job. So there's good range of motion in the hips. You can go ahead and sit down now if you'd like. Next, we'll check shoulders, and I would like you to bring your arms out to the sides, the center, and then back down to the front. Good. Next, I would like you to, both hands behind the back, touch finger over finger. Good. And then raising up, hands behind the head with the elbows out. Great. Good range of motion there. I would like arms out straight for me. Good. I want you to don't let me push them down. Good. Don't let me pull them up. Good. Bend your at the elbows. Good. Don't let me pull them away. Don't let me push them in. Good. You can have arms out straight. Let me have a hand here if I can. Go ahead and turn it. First, both arms out straight. Give me both directions. Make fist down. Turn it up. Make fist up. Good. Good job. You can go ahead and put those back down. Okay. Next, we want to work with the knee. So I'll have you put your hands beside you here for a second. And I want you to raise up, no toes, just your hip and leg muscle. I want you to lift up. Good. And then I want you to raise it up for me. Pull down. Good. Push up. Good. Pull down. Good. I want you to push the leg out for me. Good. Pull against my hand. Good. Push out. Good. Pull back. Good. Go ahead and have you lay down at this point. Good. From here, we can also check the strength and range of motion with the feet. So we're going to do a dorsiflexion, which is toes towards the head. Go ahead and pull against my hands. Good. Plantar flexion against me. Good. Eversion, which is out. So I want you to push out. Good. Push out. Good. And then push in. Inversion. Good. In. Good. While I'm down here, I'd be checking the dorsalis pedis and the posterior tibialis. Also checking around the posterior tibialis for edema. Checking the popliteal pulse, also the femoral pulse, radial pulses, brachial pulses, and if I can borrow your leg here, we would continue to check knee and hip flexion by bending out and across. And again, you would duplicate that on both sides to check. You can go ahead and sit back up if you'd like. Thank you for your assistance. That completes our musculoskeletal and neurological assessment. Thank you and have a great day.